Hello everyone, and welcome again to another episode of Tiny Matters with Dr. K. Now, as a pediatrician, I've often had parents come in with signs like stomach aches that turned out to be anxiety, bad moods that turned out to be depression, or poor sleeping that turned out to be attention problems. We talk so openly about ear infections, coughs, and diarrhea, but talks about mental health, that still feels harder, even though it's just as important. Because mental health can affect learning, relationships, and self-esteem, and early support can make all the difference. Today, we're breaking down what mental illness can look like in children, how to tell the difference between a developmental phase and a possible red flag, and how parents can start to have the conversation without shame, fear, or guilt. And to help us with that, I've invited a very special guest, Kelebogile Mojanaga-Masilela, a clinical psychologist who works with children and their families and helps them to navigate these difficulties. Thank you for joining us.
Thank you for having me, Kunzo.
When we say mental illness in children, what are we talking about? I know it's a very broad term, right? And it can range from depression and anxiety to things like ADHD. Can you help us kind of navigate that term a little bit better?
I'd love to, because I do think it's one of those terms that tend to be quite conflated in spaces or loosely, used. Colloquially, social media and so forth. It's buzzwords, right?
Yeah.
But mental illness in children is identifying in your child that there's something different about the way that they're growing. And there are appropriate developmental stages that children should go, which are healthy, and there are markers for that. I think pediatricians like yourself do quite a great job in terms of helping the parents understand that. However, there are things that tend to happen in children where they look a little bit different. And they can be scary sometimes when they look different. But once you can identify that they're different, we're able to intervene. What do I mean by difference? I mean that in the way in which a child can sometimes struggle with things as, expected as potty training, for example. That's a developmental milestone that each and every child goes through. However, some kiddies struggle more than others. Even after potty training, you find that there's kiddies who bedwet, right? And we can either normalize that and say, no, they're still learning, or it can be pervasive and ends up affecting other areas of their life, being at creche, socializing, being with family members. So it's when certain behaviors tend to be quite pervasive in how they appear in kids and they look different. So an incident of bedwetting once, not something necessarily to worry about. But if the child has successfully gone through potty training, but somehow they're turning 4, 5, 6, or still bedwets, persistent, that's where we start to raise eyebrows. So any behavior that looks different from the developmental milestones and there isn't a natural resolve, that's when we start to wonder about are there mental health challenges that the child could be experiencing.
Thank you for that. I think I really like what you said around it interfering with their kind of daily life, the activities of daily living, and I mean, when you use the bedwetting example, you think of a 3-year-old, for example. They can bedwet and they can have accidents during the day, but because it's still a normal part of, developmental progression, it's not going to interfere with the activities of daily living. It's not going to cause severe anxiety in that child. So I think that's an important thing for us to remember, that it needs to be interfering. Anytime it's interfering with our activities of daily living or just our normal functioning, that it's become a problem.
And just on that, I think just to paint the picture again, is that, a creche, there's age-appropriate behaviors, so when a child is interacting with other kids and they're the only ones bedwetting, for example, or the only ones with a speech delay, but children around that age can speak, construct sentences. So it's when you start to realize that there's something different when you look at the age group of the child, and to just be concerned about, is there something more to look into?
I think I mean, speaking as a parent, I think the difficulty with that would be the comparison trap, feeling like, why am I comparing my child to every other child and all the anxiety that can come with that, So when does it become a red flag? When do we start thinking, okay, this is not just my child throwing tantrums. This is not just my child sleeping badly or bedwetting, and I need to be concerned that there's something more going on that may need further intervention.
So mental illness in children, it tends to be quite bodily, expressed with behavior and through their body. And a simple reason for that is that developmentally, they're not at an age where they've developed full vocabulary. They're still learning the world, learning language. And a big part of that means that they can't express themselves in the way adults can or make sense of their emotions like adults can, right? So what that means is that you'll start to see them change in those environments, even with their peers. Children tend to be able to play, make friends easily, and express themselves, again, age appropriately. But there are times when a child who should be playing starts to withdraw, doesn't necessarily play much, and, they have age mates who are trying to draw them out, with play, meditation, but they don't really respond to that. We start wondering what that's about, Again, what is their body communicating? A withdrawal. Anxiety, every time your kiddie needs to go to crash, they're bedwet or they have a tummy bag or tummy. So it's about also interrogating, when do these challenges that might not necessarily be age appropriate come up? Is it context specific? Is it only when it has to do with going to grandma's house? When it has to do with school? Does it come up, when it's has something to do with going to mom? So it's really about paying attention to what's happening in their bodies. What are their bodies communicating? And why do they, again, that whole persistent thing, why does it always communicate? Why is there something happening in the child's body every time this has to happen? And it's persistent. It doesn't resolve, because kids can have bad days, we also have bad days. So it doesn't necessarily mean it's cause to worry, but it's with children, you can spot their bad days by how they respond to the environment. And that's why an environment is such an important marker to diagnosing or being worried. Because, again, yes, it's not to fall into the comparison trap, but it's been being mindful that your child doesn't exist in an environment. And there are ways in which that are age appropriate, that the child can respond to the environment. And once you don't start seeing that happen, I think it is cause to worry, especially when you start to see symptoms in the body playing out.
Okay. I think that's quite important, right? The bodily symptoms. And you mentioned a lot. You mentioned the tummy cramps, for example. You mentioned the bedwetting a little bit earlier. What are some other things that we can look out for, particularly in the context of depression? I think it's a bit intense that things like anxiety and depression can be diagnosed in children, probably the age of 4, 5, that it can, as early as that, children can already have a diagnosis of anxiety or depression. But what are other signs that parents can look out for that make us think that, okay, maybe this is more bodily sign of something else going on?
I think just maybe to note the depression thing, because I think, I've heard many parents say, my child is too young to be depressed, right? But just to say, depression can exist in children, but it does actually play out a little bit differently to how it does in adults. So with adults, you'll see that more prolonged sadness, right, and low mood. But in kiddies, depression typically is seen through irritability, when the child is really irritable. Across context, again, that's a very important thing about diagnosing. If they're irritable with mom, doesn't necessarily mean they're depressed. But if you find across all context, mom, school, playground, they're irritable, you can start actually having those sort of red flags around what's going on.
By irritable, do you mean like short-tempered, or do you mean crying all the time?
Crying all the time, short-tempered, nothing. They enjoy things for a short while, and then they don't want to do it, and it can come out again. We do wonder and take into consideration age appropriateness, right? You know, the terrible choosing the tantrums, right?
Exactly. They're irritable all the time when they're 3.
Exactly. And a part of that, again, is measuring developmental milestones. So certain things won't be diagnosable because you look at the development trajectory of the child and you can tend to see, this is appropriate. But there's some behaviors that tend to be inappropriate, for their age. So it's in things like that. So yes, it's the bedwetting, it's the irritability that won't really, it's not a phase, it's not a bad day, it's not a bad moment, it's just pervasive. Again, highlighting the pervasive nature of these symptoms with their mental health. But yeah, tummy bags, oh my goodness, that's a very, very common indicator of anxiety, right? Every time a child has to go to school, they have a tummy bag. So I get parents say, no, you're just faking, because when I say don't go to school, then you're fine, right? But it's not that the kid was actually faking it or pretending to be sick, but their body is communicating that anxiety through the tummy bag. Now, when you eliminate the source of anxiety, i.e. school, of course they're going to bounce up the walls. They're going to be fine. So, but then what this also means for parents especially is being able to pay attention to patterns. Right? Is this a thing that happens all the time? Is this something that happens during the exam season, sports season? Just being mindful of this it's just a bad day, this pervasive, but it's very important to be mindful of such patterns and behaviors in children, but they're not faking it. They actually do have a tummy bag until you take away the source of anxiety. Another example I could make is I find when I talk to parents, I like always to relate it back to them. When you're anxious about having a speech or having to do a speech or a presentation in front of people, all of a sudden you need to pee all the time, or your tummy's in knots, and you're just feeling uneasy, or you're trembling, right? It's your body's way of communicating the anxiety, right?
But we kind of are able to localize where it's coming from
and regulate it. But the thing there is, the minute you eliminate the presentation, the talk, all of a sudden you're fine.
Feel better, Straight after,
right? So imagine for a little tiny body that can't make sense of the world yet, doesn't have the language to make sense of the world yet. And you put them in this environment where you're like, you're gonna do it no matter what, and you become another source of anxiety. You can't really want to avoid you and school.
I run away from home.
But it's just because they can't make sense of the world yet in the way that we can.
How does the home environment help with this? Like, their dietary routine, their play, how does that kind of help with anxiety and depression in children?
Oh my goodness, it's a very important factor of helping a child through mental illness. Even in the instance where you do bring a child to see a psychologist, majority of the work is done at home. Therapy is 45 minutes once a week. Home is all the time. So there's so much work that I can do as a professional, but I do need the collaboration with parents, because that's where they spend most of their time, right? So a very important part is the home environment. And children, because they can't necessarily make sense of the world like we can, and maybe just to quickly digress, one of the reasons why is because the frontal lobe, which is the front part of the brain, really, is the last part of the brain to develop. And it only develops at 25, right? But that's a part of the brain. So, as we know, that's responsible for executive functioning, reasoning, logic, consequence management. So imagine a tiny little 5-year-old that doesn't have a fully developed, it's 5 years into development. It still has 20 more years to go, right? So making sense of the world is something that the parents need to help facilitate, because they're still very limited in their understanding of the world, right? So in a world where you with parents and their children are struggling, it's very important at home to be able to create an environment that responds to that, right? And because, again, children are not able to make sense of the world like we do, changes in their lives can cause so much anxiety, right?
Yeah.
Because they can't reason like we can.
Yeah.
You know, that,
Yeah.
no, it's only momentary, it's just for today. But you find that things that are unstable in the home environment can create a lot of anxiety for the child. Even unassuming things.
Yeah.
You know, it doesn't necessarily always mean that mental illness or mental health problems emerge in children where there's bad parenting. It's not even about bad parenting. It's about what does the environment facilitate, and can they be able to hold it? Almost in a more literal way as well as it is figurative, right? Can they hold it in? And if there's too much changes, sometimes they don't know how to respond to it and they get dysregulated. So that's why routine is so important, right? So routine also is important for parents, because it's easier to spot your kid if something is not okay, because you know, dinner's at 6, bath time is at 8, bedtime is at 9, just for example. And if things start to shift, it's quicker to respond. But if everything in the environment, there's no structure, it's very hard for you to even pick up that there's something wrong with your child. So that's why the environment is so important.
Yeah, it's remarkable to see often the difference that even a dysfunctional environment, the difference that can be made once there's stability, you know, once there's routine and children know exactly how things are going to turn out, what it does for their self-esteem, what it does for their confidence in the parents and in the environment itself. I think routine is such a big thing, almost so irrespective of what's going on around them. Okay, so let's say a parent is aware of a struggle that their child is having, and we particularly think it's related to school. What's the best approach to that kind of thing? Is it therapy immediately? Is it trying to get your child to talk about it? Is it going to the school and addressing it with the teacher? What is the best way to kind of handle that, especially if you think it's leaning towards causing mental problems in your child?
The first point of contact is actually your kiddie, right? You know, you are identifying a struggle, but you just want to make sure that, you know, what you're making sense of or what you're seeing is something that they can articulate or not, because that also informs the conversation you have with the teacher, right? So the conversation with the teacher is inevitable. You're going to go there. But the information that, you know, even say something simple as, my child won't even talk to me about it, helps inform the discussion you're going to have with the teacher. So the point of contact is really just your little kiddie, and just finding out, you know, notice that every time you have to go to school, you have a headache, a tummy bug, what's going on? And is there something happening? Is it something that's hard to talk about? Just as a point of meeting them where they are. But based on the responses, that's when you can go to a school and sort of say, you know what, I tried having a conversation with him. I see his behavior is different when it comes to school. His grades are dropping. You know, there's waiting in their pants, in your recess. You start to do investigations, right? And you're just like, so I'm just wondering if you picked anything up, and starting that conversation. So teachers sometimes are overwhelmed. I've come across that, you know, because sometimes I call teachers and there's so much happening in the classroom. But I think that also is important information to have. Am I dealing with the teachers overwhelmed with the amount of work or the learners in the class? So be able to also deduce, is it something about that that's making my kiddie struggle? But the point of call is kiddie, school. But I think then a step further would be to try and assess if it happens in other areas of their lives. Does it happen after care? If they go to aftercare, does it happen, you know, when they're visiting family? Does it happen on weekends? And I think that kind of information is the best kind of information that when you end up going to a psychologist now to say, you know what, this thing is pervasive and my child is struggling, then you're able to sort of have the conversation with the psychologist, say, I have spoken to the school. It's not across context. It's related to school. It's across context, you know. It gives it a richer experience, a richer description of what your child might be going through, and we then know what point to meet the needs of the child at that time.
Okay. All right. Yeah, I imagine though speaking to a child is quite difficult. They don't often have the language to explain, I'm feeling anxious because I have assessments or whatever at school. They don't always, like you're saying, have the language to explain it. And I imagine that's where psychotherapy, seeing a psychologist like yourself, play therapy and things like that come into play. How does play therapy work? Like why is it such a big modality in child therapy?
Oh, it's big and very important for a very simple reason, actually. Children should play, right? And when I have sort of play therapy with kids, the first sign of that there is a struggle here that might be happening if they struggle to play in this space. We try to make our rooms as quite playful and colorful as possible. So in play therapy, typically children would want to come in and just play. So that's where we start picking up problem. Can they play, can they not play?
Right.
But an important thing is because children, again, don't have the language, right? So they best communicate through play. And unconscious processes happen, which are quite complicated, but one of the things that play therapy does is that it helps us pick up where could the difficulties be happening in their lives. So we'd have animals, for example. So in the animal play, you can hear the sort of way the animals talk to each other or how they relate to the animals. It's almost fantasy, right?
Okay.
And a child should be able to live in fantasy in the sense of having an imagination, And once some children, you find they're concrete. They can't even imagine an animal talking.
Okay.
And you start to wonder about that because it's age appropriate to make a horsey talk, or have a baby that needs food. If that's what's happening. So again, we look at how they engage the environment, the play environment, how they engage the toys, how they not. Do they invite me into the play? Don't they? Do they not? So it's all just behavior. Because again, it's very hard for them to elaborate. But through their fantasy, you get actually quite a beautiful picture of what's going on in their internal world. Things that they don't know who's the big bad bear. But somehow there's always a big bad bear in their story, right? And me tracking that. So as play goes on, I track what happens to the big bad bear.
Where
did it go? Did it get punished? Was it affectionately loved? So again, you engage the child at the point of understanding, the point of their fantasies, and I sort of track it from there. So it's not about trying to make them adults and to reason. And not really. It's really about understanding how they engage with the play.
And what their world is like for them.
And what the world is like for them.
And
then the big part of my feedback is that, so I'm one of the child psychologists, who tend to, can I say that again?
Sure.
I'm one of the child psychologists who tend to prefer that I won't see your child unless you come for parental counseling, right? Because you do sometimes get parents are saying, fix my child.
Fix. It's broken.
But the big part of the fixing is the parents. So when I have these assessments and I draw on these themes and so forth, I'm able to feedback the person who's taking care of the child. What's actually going on for your child? And helping you understand their world and their point of view. Right?
I remember, I imagine that's quite difficult for a parent to do. I think that you actually have to sit with yourself a little bit and actually what's actually going on that's starting to affect your child, and that's quite difficult, and I feel inclined to ask you around the stigmatization around mental health. I mean, in adults, it's so stigmatized, and it's not something that's, it's getting a little bit better, but it's not really something that's very easily or readily spoken about. Is that a little bit better in the space of children? Are parents a little bit more willing to accept certain diagnoses, to discuss certain stigmas around mental health?
Oh, that one is a bit of a tough one, because I think most of my colleagues prefer not to work with children, because a big part of working with children is working with adults. And I think the biggest stigma that I hopefully in this platform would like to dispel is that mental illness or mental challenges in children is not necessarily all about bad parenting. So sometimes genetic plays a very important part of how it plays out in a child, where if there's ADHD, for example, hyper attention deficit and hyperactive disorder tends to be quite genetically passed through, right? So you'd find that some parents feel like, well, you want to put my child on medication.
Or I was like this as a child and I turned out okay.
Okay, right?
Yeah, we hear that often.
But they negate the struggle it took for them to go through school, to sit on presentation, to sit through seminars, right? How, they had to apply themselves more than the average kid. So you can just imagine in a world where this kid wants to finish their work in class, wants to concentrate. And now parents, you find that they're like, no, they'll turn out just fine. And so that in some ways, a child could find coping mechanisms. We're human beings. The brain will try and find ways to cope and survive in any way. But it doesn't mean it's easy.
Or normal. Or adaptive.
Or good. Good, right? Yeah. And I'll use ADHD as quite an example because how it plays out, it sometimes can be quite good or quite sad, right? Because if your brain can't pay attention and you can't focus, it means that in class you're going to be bored easily, you won't finish your work on time, you'll distract other kids because you want to chat and all of that stuff. But then what ends up happening in a classroom setting, you end up being the disruptive kid.
Yes, the naughty child.
Yeah. And let's just think for a minute, what does labeling a child, the naughty child, do to them, right? And we can think of a lot of things, but every time you go to me, you're always talking, you're always naughty, and you're always getting punished or demerits. Eventually, what does it do? It affects your self-esteem.
Yeah.
So yes, you'll probably be able to get from grade to grade, but what's the collateral damage in all of that?
Yeah.
It means that, you're passing, but now you've let the self-esteem suffer as a result.
Yeah.
Because every now and then you're getting yelled at, you always have a red pen through your books. And, sometimes you find that then kids end up saying, you know what, because they don't really fail because they're not smart, but it's because they just don't finish on time, as an example. You find that then they're just like, let me rather be the naughty kid rather than be the dumb kid.
Yeah.
Or the kid that's not smart enough, right?
Yeah.
And then they end up being what? The class clown.
Yeah, the funny one.
The funny one, right? And just think about that. The funny kid, the class clown. And then they rather take that persona because they're not failing because they're not smart. They're failing because they're busy making everybody laugh.
Yeah.
Right?
Yeah.
What are the long-term effects of that is what we need to ask ourselves.
I think we don't think about that internal conversation that this child has now had with himself repeatedly and what it means for his self-esteem and his confidence going forward.
And then the kid grows. They get in there to be a teenager.
Yeah.
And what happens in teenagers, they start getting experimental and so forth. So what if they, get in situations where there's peer pressure and somebody says, hey, I'll smoke a blunt or something along those lines. And then all of a sudden their mind is calm and they like the feeling of their mind being calm. Then they self-medicate from an early age where they didn't have to.
Yeah.
Because yes, cannabis is, not
legal.
Is illegal and kids should not do it. But in a world where they might somehow get exposure to it and all of a sudden it does the thing that feels so soothing.
Therapeutic.
Right? What does that mean? So it's not to say all children who don't medicate their ADHD early will end up smoking cannabis. But I'm just painting a picture, a long-term picture around what it looks like when we look at my child getting the diagnosis of ADHD being like, no, not my kid, right? Or we've been okay. What that could do to the child, what that has done maybe for you. Maybe it's a moment of introspection for the parent. How a struggle, you've had to struggle through exam rooms. Right? Do you really want your kid to go through that? And that's the internal conversations you have. What does this diagnosis mean? No, it's not to say your child is broken. It's information is power. It's giving you the power to able to change their trajectory in a world where it could go either way.
Yeah. And I think I see a lot of a lot of children with ADHD. And I mean, there's so many confounding factors at the moment, you know. There's screen time, there's inadequate stimulation, there's teachers that basically just want a class full of quiet children that don't move and don't do anything. So there is, it's a buzzword at the moment, you know, adults, children, right? And there is almost a tendency towards making that diagnosis very quickly, right? Yes, we have questionnaires and stuff, but there's definitely, I've seen a tendency towards almost an over-diagnosis, right? And then you get two sets of parents. So you get the parents that say, no, it's fine, he's going to outgrow it. I don't want my child to be dependent on medication, like the case that you're describing. And then you get a lot of parents that are like, okay, so can I have the medication? And then they do nothing else. So they don't want to do, you know, the OT. They don't want to address the underlying issues. They don't want to see a psychologist, you know. And I think that for me, the one thing that sticks out around mental health is that, number one, it's not a one-size-fits-all approach to treatment. And number two, it really is a community effort. It really is a team effort. And yes, the home is a big part of it. School is a big part of it. But also psychologists like yourself, occupational therapists and our allies are such a big part of helping them kind of navigate and process and package the world, you know. And I wish more parents could understand that, right? Let's say I'm bringing my child to you for the first time. What can I expect? How do I prepare for a visit with a psychologist, suspecting that my child may have some sort of mental illness?
So what you can expect for a first session is that it'll typically be a family session. Big reason, what we've discussed in today's episode, basically just, it's a family session to get a sense of, does everybody who lives with the child get the sense that you are getting as a parent? Because sometimes as parents, we stress, we go through a lot, and we can project, or sometimes we can, you know, sometimes want our kid to have a diagnosis, so you have the reason for why they're being naughty, you know, like you're saying, there can be over-diagnosis or under-diagnosis. But basically, a first session is a family session to ascertain, does everybody have the same sense about the child? Secondly, also psychological history. So what we do in the first session is we choose to do a history assessment, you know, where the family's from, who's still around in the family, who's the kids, who's the person the kid is close to the most. Are there any history of mental health challenges in the family, medical conditions? So the first session really is not a therapy session. It's not a play therapy session. It's just, so don't get alarmed when your therapist says, okay, come in with the child. I've gotten instances where they're like, no, I'm not the issue.
Fine. I'm not
fine.
the patient.
No, but the reason why is that we need to be able to understand the child in context. Right? Out of context, anything can look abnormal. But within context, cultural context, religious context, home context, family traditions context, that helps us get a sense of, okay, how do we understand the kiddie better? So the family session is so important, and that's why you'll get called in, just to get a sense of what's around the child, and also getting to understand what the challenges have been. And then after that, you start to have one-on-one sessions with the child. But different psychologists will work differently, but how I tend to practice is that I have 4 sessions with the child one-on-one, and then after the 4 sessions, I do a feedback, a session with the parents, which is the parental counseling sort of, just to be able to say, this are the things I'm picking up. What do you think about it? So even the feedback doesn't necessarily always have to be, that's the problem, what's resolved, but it's to be say, this is what I'm picking up. Are you picking up the same things? And how is that playing out? And typically, that's the trajectory. And if more sessions will be needed, we'll ask for more sessions. But typically, it's really a collaborative process with children particularly. As an adult, you can go there and no one has to know you're there. But with children, people in their system needs to know and needs to understand what's going on with their child.
I think it's quite important that it's kind of a family affair, right? But we also know that family opinions can be very strong, you know. So how do we balance that? How we balance the cultural context and also like clinical advice and just the acceptance from a traditional meets medical point of view that my child has a mental illness, you know. I think that's quite difficult for parents to sit with. You know what I mean?
Yeah, it goes back to destigmatizing it, right? We don't just destigmatize in our homes, we have to destigmatize with family members. We need to destigmatize in our communities, you know, awareness campaigns in the families, involving, if you have somebody who is involved in your child's life, bring them to the session so they can also be psychoeducated around this is what's happening with my child and this is what the psychologist is picking up. And then we are trained enough to be able to also meet the parent where they are, or the caregivers, right? How they've come to understand the behavior. Because again, if you don't have an understanding of where the behavior comes from, it's very hard to treat, right? And that's where cultural norms come in, where people say, this is how we deal with kids who are naughty. This is how we deal with kids with tummy bugs. This is how we deal with kids who are bedwetting. We spank them. You know, there's all those things, you know, until they get it right.
Don't do that.
Please don't. You're causing more anxiety. But part of that is saying that, you know, the community needs to be able to play a part in destigmatizing. And a big part of that, like I said, could be inviting the people who are close to the village that's helping you raise your child. But I think also for the parents to be open-minded about openly speaking about it. I think sometimes I find, I don't know if you find the same thing, that the minute you give a child a diagnosis, it always seems like it has to be a secret. Right? I can't put my child on meds because they go to their dad's house and they go to or my grandmother's house, and then therefore they'll see that there's something wrong. And that already sort of labels it rather than empowering the child to say, we know what's happening and this is how we're resolving it. And now they have to hide their meds every time they go to grand's house for the holidays, or they go to dad's house if it's, you know, a split home. But part of it is parents need to be comfortable enough to also be able to speak openly about mental illness, especially in their children. Because what it also does is that it empowers the family and the next generation. I'll tell you how that plays out. So when we do like this psych history to say, check, has there been history of any mental illnesses in the family? Sometimes you find people saying no. But they say no because no one has ever said anything. Not necessarily because they're hiding it, not necessarily because there isn't. But there's some people in the family who then don't necessarily disclose. And why it's so important to disclose, and why we take family histories or psych histories, and why it's so important is that should the child need to be medicated, the psychiatrist needs to know if they're already genetically loaded with depression, you know, or anxiety, because that informs the dosage, right? Because you don't want also to give a child something that's too strong or too weak, right? So it empowers even the professionals to know where to start.
I've often heard psychiatrists say that genetic causes of mental illness are the hardest to treat. So what more so if you don't have that information?
Right? So it's destigmatizing is about empowering not just you and your child, but empowering the family, where we can openly talk about, you know, my child is on the spectrum, and they want to explain what the spectrum is. And should somebody have it later on, we're like, oh, that's why Uncle Span was like
that.
So now you're having open chats. Oh no, we don't talk about Uncle Span because people found them weird. So let's not talk about something we don't understand because we don't know the name to that. But once you start to say, this is what my child is.
Let's talk about my child.
And someone is able to say, oh, that's my uncle. You know, so it's so empowering to be able to openly speak about mental illness and destigmatize it.
What would you say to parents who feel guilty? They want to bring their child, they think there's a problem, but they feel a sense of guilt or a sense of fear or a sense of shame around the fact that we are now worried about this in our child?
All I can say is that, you know, you do want to give your child a fair chance at life, because life is hard and it comes with ups and downs. You know this too well as adults. But you want to sort of empower your child with the kind of foundations that help build resilience for that hard life. And some of us wish we had the tools earlier on.
Yeah, definitely.
You know, as adults, if you had to reflect, you know, you think about how, you know, I wish I knew that earlier, right? So imagine empowering your child with the knowledge so early, the kind of knowledge that formed the foundation, right? That is really the greatest gift you can give your child.
Yeah.
Because some of the things you wish you knew, they get an advantage of just sort of being able to be able to resolve. Right?
And early on, right?
And early on, when you're still forming the foundation, when the brain is still developing. Imagine that as the neurons form and the brain develops, the kind of resilience that you are affording your child so early on. Because you're not going to always be there, unfortunately. And I don't mean in the sense that you'll be gone and die, but I mean in the sense that they'll want to move out of home. They want to start families. So the best gift I think you can give your child is sort of those early interventions and being able to reframe it in your mind that it's not that my child has a problem or they're broken, but be able to like, you know what, how do I help my struggling kid? And I think a very important thing is the language we use. Oh my goodness, can I just say that? Like, labeling kids as crazy, naughty, and you know, all these things, you know, to be very careful what kind of names you give.
It informs the internal dialogue that they have with themselves.
And their self-esteem, right? So I know we sort of use it loosely, gentle parenting, but the sort of resilience, the work of helping your child to go to be a resilient adult, sometimes needs to be gentle. And then to answer your question, it really is a matter of reframing it. How do I empower my child when I can really spot these difficulties so early on to have a healthier trajectory as they grow up?
And I think also reminding parents that you're enough, you know, this is not your fault. You're doing well. By the fact that the mere fact that you are worried, that we are having this conversation, you are a good parent. But sometimes life happens, right? And I think we just need to give them the tools to be able to deal with this life that is happening, right? Irrespective of us.
And the village, Kuzo, is not just your family. The village is also medical professionals, your pediatrician, your psychologist, your psychiatrist. They can form part of your village. And if you allow them to form part of your village, oh my goodness. Even you start to feel light as a parent. You don't feel so burdened.
Like you have to do everything.
And know everything.
And thank you for that. I mean, the one thing I've taken away from this conversation is that it's really just about understanding, you know, like understanding what's going on so that you can have the conversations with your child. I think asking for help is never a sign of weakness. It's not something that we need to be ashamed of. By having these conversations, we are already making it so much easier to be better for our children. Thank you so much, Lebo, for joining me.
Thank you, Kuzo, for having me.
If you enjoyed this episode, please share it with someone who could benefit from it. Also, don't forget to like, share, subscribe, and post any questions you have in the comment box below. And don't forget, stay kind and stay curious.